Happy Father's Day, and thank you for joining us live. We're here in lovely Omaha, Nebraska with board-certified dermatologist Dr. Joel Schlessinger. Thank you for having us.
Great to have you here.
Thank you. I'm very excited. I hear we've got a couple live CoolSculpting treatments happening this afternoon.
We do.
Can you tell me a little bit about what we're going to see? Give us a sneak peek.
Well, it's going to be great. We're going to have a chin, we're going to have an abdomen, and we're going to have two people that are males who are interested in removing unwanted areas of fat. So CoolSculpting, such a great treatment for both of these areas.
This is exciting for all of you who are joining us live. You just heard Dr. Schlessinger say we've got two live treatments happening this afternoon, a submental treatment and an abdomen treatment. You're going to find out things like who's a good candidate, what the treatment looks like, how it feels, how much it costs. Are we going to dive into that one today?
Absolutely.
Perfect. So we're going to take a look at all of these aspects so you're really going to get to understand what the CoolSculpting procedure truly is. How are your vocal cords? Warmed up?
I'm ready to go.
You're prepared to answer some questions?
You betcha.
For all of you who are out there watching live, we'd love for you to participate. Please leave comments and questions in the feed below. We've got specialists who are watching live who are here to answer everything that they can while we're doing this live CoolSculpting treatment. So, Dr. Schlessinger, before we jump in and meet our patient, we want to know, can you tell us a little bit about yourself, who you are, and what your practice looks like?
Well, I'm a board-certified dermatologist in Omaha, Nebraska. I've been practicing CoolSculpting since 2008, so it's something that is near and dear to me.
I have to tell you, we are in the most beautiful office, and Dr. Schlessinger has an incredible reputation. Doctor, we're curious, being a dermatologist, what encouraged you to bring CoolSculpting into your practice in the first place?
Well, you know, Kara, the thing about CoolSculpting is, and for the audience, it's something that people want, but many people are afraid to do it because they don't want something that's invasive. CoolSculpting, non-invasive, little or no downtime, it makes it a very simple decision.
This is amazing. So what he's saying is there's a demand for non-invasive treatment here in your practice.
Oh, there is definitely a demand. There's a demand in this country, and I think that most importantly, Kara, the demand is something that is both for women and for men. And today we're going to be showing that men are very interested in this procedure, and they are just as interested in getting unwanted fat treated as women.
Oh, I love it. So the live treatments that we're going to be seeing are both men?
Absolutely.
Incredible. So you believe in the treatment, right?
Oh, for sure. I think this is something that is really a great addition to everybody's armamentarium and something that people are excited to have done and excited to have a change in themselves.
What about those patients who maybe don't perhaps believe in the technology yet, or people who don't think that it really works? What do you say to those patients?
Well, you know, they have to be believers once they see the results. It's something that within 2-3 months you're going to see a dramatic improvement, and you can see an improvement in as little as 3 weeks, actually.
Are patients able to see before and after photos within your practice?
Absolutely.
Perfect. Should we jump in? Should we see a live treatment?
Yes.
Perfect. Before we do that, for all of you who are tuning in at home, please leave in the comments below what area you would like to have a CoolSculpting treatment in. What areas can you have CoolSculpting treatments in?
So CoolSculpting is so great. It can be done on the abdomen, the thighs, the flanks or love handles. You can have it on the upper arms and bra and the buttock area, banana roll area as well.
The banana roll. Okay, we've got a lot of areas of potential. So for all of you out there, leave in the comment below any area that you're interested in having treated with CoolSculpting.
Oh, and back fat.
There's a little something for everybody is what you're saying.
Absolutely.
Beautiful. Should we meet our first patient?
Please.
Let's do it.
So, Noah, nice to see you.
Nice to see you.
So, Noah, you're interested in the abdominal area, right?
I am indeed.
So abdominal area, that's a great area for guys. Well, let's take a look at your abdominal area. So I'm going to touch the area, and you can see Noah's in very good shape, but he just has a little unwanted area on the lower abdomen.
Dr. Schlessinger, I see you pinching his abdomen. What are you looking for while you're doing that?
Well, you know, the audience members may wonder why I'm pinching the abdomen, but you know, there's fat that we have to find out if it's a good fat for this treatment. So you can't be exactly without enough fat, and if you get too much fat, then you're going to have to divide the treatment into different sessions. Noah's absolutely perfect. So he has about 2 teeny little treatments on his lower abdomen. So I'm going to put this little measurement guide, and so it roughly shows where I'm going to treat. So right here and right here on Noah, that's where we're going to go ahead and place it, and we'll be able to tell once it's done how the area did.
Wow, that looks like a beautiful treatment. I'm curious, you said that an abdomen is a great treatment for gentlemen. Can women also treat their abdomen?
Great question. Well, so women, definitely candidates for CoolSculpting, and probably women are perfect for the abdomen. And women tend to have a little bit more on the upper abdomen, whereas guys tend to have more in the lower abdomen. But everybody is unique, and so we sculpt a treatment and we make a program that is good for everybody.
Perfect. I see you were pinching and pulling his tissue away from his body, and you were talking about different types of fat and different dimensions of fat. If you can pull the tissue away and pinch it, that subcutaneous fat, is that what you're treating?
Absolutely. So the area that we're treating is that area right below the skin that has a little bit of fat. So we want to make sure that there is fat there, because sometimes people just simply have laxity, and that's not going to be treated. So you want to get something that has enough fat, perhaps not too much fat. So he's an absolutely perfect candidate.
I think it's interesting that you say that you're talking about fat and laxity. It seems like the assessment is really the most important part of the CoolSculpting treatment. Can you talk to me about why a patient should come in and have an assessment in your practice?
Well, you will never know, and this is something, Noah, that we will go over when we do the markings on you, but you'll never know exactly what you're going to do until we mark it and make sure that you're the right candidate for it. So for those in the audience who are looking for a treatment like CoolSculpting, it's important to see your physician and craft a plan that is good for you. You want to make sure that you have the good amount of expectations and the proper expectations, and that the physician that you're going to see will tell you that they can deliver upon that. Now, CoolSculpting is one of those things where I truly do think that it's perfect for a guy who doesn't want to have downtime, and I think that you see a lot of people that want to have their abdominal areas treated. So for those of you in the audience, are any of you interested in having your abdominal areas treated? I bet you do.
If you're interested in having your abdominal area treated, why don't you go ahead and put a snowflake emoji in the comments below? We'd love to see some snowflakes come through. Whoa, Dr. Schlessinger, you're popular. We've got a few coming through already.
Well, and it's summer. That's the amazing thing.
I think we're excited. There are so many snowflakes coming through for the abdomen. I think it's time that we see his abdomen marked out so we can actually visualize what the treatment's going to look like.
Absolutely. Okay, so Noah, this is actually, it's not going to hurt or anything. I'm just going to take this little card here, and we're going to mark this area. So, as Kara said, I've pinched it, and I'm going to mark where the majority of the fat lies.
That X looks like it's on the center, like a peak on the abdomen. Is that what you're looking for?
Absolutely. Where the fat is predominantly located, right there. So let's go here. We're going to mark this along that line there. Going to mark 2 areas here, 2 areas here, and then we're going to go to the other side here. And it's very simple. It's something that will take a very small amount of time, like 35 minutes for each treatment session.
Wow, a treatment is only 35 minutes for each session on the abdomen?
Only 35 minutes for each treatment session. So it's extraordinarily simple. You've never been able to get this done so quickly. In fact, the newer treatments, in our clinic, we have dual treatments. So we can get this area entirely treated very simply. It is freezing the fat. It's actually taking that fat and freezing it, but then it goes back to normal, and then gradually over the next 3 weeks to a couple of months, that fat is removed and it's extruded through the body, so it is gone.
Amazing. So it looks like you have incredible coverage on Noah's abdomen. So we're going to be able to treat that entire space?
We will.
And then patients can start to see results at 30 days, but best results are around 90 days?
30 to 90 days, yes.
Amazing. I'm excited. Are you excited?
I think this is going to be great.
Perfect. I think we should get the treatment started. Maybe we should put the application on. Are you nervous?
Slightly.
Slightly nervous? That's perfectly normal. I think anybody doing a treatment like this would be nervous at the start. Yeah.
I'm excited then.
Okay, so Noah's sitting down. You're getting comfortable. How do you feel?
Good, good.
Good?
Comfortable.
Tell us, why are you having the treatment done in the first place? Why are you excited about treating your abdomen?
Summer's around the corner.
Yeah,
Bathing
summer.
suit season.
You're excited to have the treatment?
I think that for those of the people in the audience who are thinking about this, would you do it if it had an invasive treatment versus a non-invasive treatment like this? You're going to see just how simple this is when we put on the applicator for Noah.
Perfect. Megan, what are you doing right now? What are you wiping him with?
Cleansing the area with the prep wipe.
Ah, cleansing, protecting the space. How does it feel?
It's cool.
Just
Just
cool?
cooling, just like a cooling effect like alcohol would be, like rubbing alcohol.
Does it hurt?
Not at all.
Not at all. Okay. So we're cleansing the area. That looks great. It doesn't hurt. It feels cold.
And we're about to feel real cold.
Freeze it off.
And now what are you opening, Megan?
I'm opening the gel pack.
Perfect. So the gel pad, it's to protect the patient, right?
Correct.
Beautiful. And what's the gel pad gonna feel like for Noah?
A little cold going on, but not bad.
A little cold. It looks a little sticky. Is
Yeah.
it sticky?
Sticky and wet.
Perfect. So it looks like you're covering the entire treatment area with this gel pad.
Yes.
And that's gonna protect the patient's tissue?
Yep.
Beautiful. How does that feel, Noah?
Just feels like one of those sheet masks that you would wear.
At nighttime?
Yes.
Yeah.
So now Megan is putting in the settings for the machine. So the machine is getting ready.
Perfect. So just that little applicator is what's going to be used to draw the tissue in?
Right.
And then it has a vacuum inside of it?
It has a vacuum, so it sucks the area in. The incredible thing about CoolSculpting is just how simple it is. It's really not an intricate process, but it just simply freezes the fat, does it in a safe, effective, and clinically proven way, and it removes unwanted fat that way.
It's amazing.
You're going to see it sucking in there, and
Wow.
then Noah will just hang out for 35 minutes and watch his fat disappear over the next 3 weeks to a couple of months.
It's already on, the suction's on?
It is.
How did it feel?
It just feels like a suction cup would.
Does it hurt?
No,
Are you uncomfortable?
not at all. It's
No.
a little odd, but it's not uncomfortable.
Yeah, a little strange, something you've never felt before.
All right, I'm gonna hold that for me for a sec. Pillow.
Beautiful.
Now we also have these little things that put it in place, so Noah will hang out here for the next 35 minutes and he'll just relax. He may read, he may watch a little bit of TV. It's just a simple procedure. There's nothing about this that is intimidating. It's just kind of, you know, it's run of the mill. You're just hanging out and watching your fat getting frozen.
Wait, this is very exciting. So he has 35 minutes to himself to read, take a nap, read a book, watch Netflix.
By the time he's done with his emails, he'll probably be done with the CoolSculpting session.
Get to your emails.
Sounds
You don't
good,
have
yeah.
much time. Your treatment's almost done. So we've got one more treatment to see, don't we?
We do. We have a chin coming up.
Should we go and see how that's doing?
Let's do it.
Okay.
Noah, have a good time. We'll see you in
Thank
about
you.
35 minutes.
Thank you.
Bye,
Thank you.
Noah.
Okay, so we're here with Flip. Flip is just about done with his procedure. How did it go? Excellent. So excellent job. We have done one half of Flip's chin. We're going to do the other half to follow, but you're going to get to see the applicator coming off, which is really kind of cool. You'll get to see how this area looks right after it. It's pretty neat.
Dr. Schlessinger, this is very exciting. Flip gave us a thumbs up, so everything's going well. If you remember, we just saw the abdomen treatment, the assessment, and the application. Now you're gonna get to see the end of the treatment. We're gonna take the applicator off and find out what it felt like for the patient.
And it looks kind of different. So Megan, my star nurse, is going to come over and take off the applicator, and you'll see initially it will look like man, this is different, but then within even a few minutes, it's going to look normal. You're going to see that the area goes back, and Flip could probably even go out to dinner tonight and nobody would know.
Amazing, amazing. So what you're saying is he can have this treatment done and go back to his normal lifestyle with minimal downtime.
You betcha.
Wow, so 45 minutes for this treatment.
45 minutes.
Perfect. So men and women can both come in for this treatment?
Men and women are great for this. I have to say that this is something where probably men outdo women as far as who is accessing this treatment. I see an awful lot of men who are in the corporate world, they're just seeing it. And you know what? The other thing, tech neck, oh my goodness, that is a deal. There are so many people that are looking down on their phones and they see that, and then they look at the selfies and they see something they do not want to see.
That is hilarious. I mean, it's true. You can't hide this with a tie, right?
Not easy to.
So I'm excited. We've got a bunch of people joining us live. You've been able to see an abdominal treatment. You're going to see the end of this submental treatment. For those of you who'd like to have CoolSculpting, go ahead and put a snowflake in the comments below. For those of you who are interested, tell us how interested you are with a number 10.
Lots of snowflakes there.
Snowflakes! Yes, people are interested. They're exciting. Look at that. What are we doing?
In honor of Father's Day.
We're doing a 2-minute massage.
A 2-minute massage. When you took the applicator off of the patient, it looked a little red. Is it supposed to be red?
Yes.
Is it just cold?
Yeah, that's just what it looks like. So basically, applicator is going on it, the fat is being suctioned into it, and then we freeze the fat. That fat that's frozen is very firm when we take it off, but it goes back almost immediately.
Mm-hmm. So what does it feel like? Why are we doing this massage?
That's actually going to get us better results. So we get better results. So, you know, tell me, Flip, I don't know if you can talk right now, but how does it feel? Is it okay? Good.
It just feels cold.
Yeah.
I don't really feel anything. I guess
Flip,
frozen.
when you put the treatment on, did the suction feel weird? Did it hurt?
It didn't hurt. I mean, it just suctions in. I mean, it's pretty ton of it.
Yeah. And then is he going to feel the cold, Dr. Schlessinger?
No, that's the thing. Cold is not one of those sensations that you feel after it happens. So when you get too cold, it just feels like nothing. It's just not there.
So he feels the cold when the treatment starts, and then when the treatment's over with, he's not going to feel the cold any longer.
Very short period of time he feels the cold. After that, it's just there.
Flip, do you still feel cold in your area of treatment?
I mean, it still feels colder than the rest of my skin, yeah.
Yeah, and it's starting to go away?
Yeah, it's fading.
How's the massage?
It feels like she's moving a clump around. But
Well, it looks really great. I mean, your double chin's already gone right back.
thanks.
Well, back to normal, and it'll be better. You know, Flip, most of my patients say that within one treatment, they start to see the results themselves, and then on the second treatment, their friends and family can see the results. So it's really something that you can see a gradual improvement.
Oh, it's amazing. Now that his treatment's done, I think that we should take some questions. We actually received emails before we did this Facebook Live, so we've got potential patients who want to find out some answers from you, Dr. Schlessinger.
And I think that Matt may have some questions for us.
Okay.
Okay.
Jackie wants to know what happens to the fat after the treatment.
Well, that fat is suctioned in, then it's frozen, then it's something that the body takes out gently, and it's gone through the system in a very short period of time.
That sounds good, doesn't it, Flip?
Yes.
We have another question coming in. Allison. Allison wants to know from you, Dr. Schlessinger, how long until you're going to see results?
Well, it takes a very short period of time. About 3 weeks is when you're going to start to see some results, and then about 2 months is when you're going to see the optimal results. Now, keep in mind, in somebody like Flip, we're going to do 2 sessions separated by approximately a month. So we're going to go ahead and do the second session, and by the end of that second session, he'll even be seeing some results, and then about a month or 2 after that, final results.
Oh, this is incredible. So you start to see results at 30 days, and at 90 days you see best results. So
Yes.
fat cells are being eliminated from your body for 90 days.
90 days.
Incredible. We've got another one. I told you, are your vocal cords warmed up? Are you ready? You've got a lot of questions. Emily wants to know, how long does a treatment take?
Well, with the newer types of applicators,
Yeah.
anywhere from 35 minutes to approximately an hour. But here's the deal. We have 2 CoolSculpting units. So with two CoolSculpting units, we can actually do something like on flip, we could do a chin, and we could do an abdomen, or we could do 2 flanks or something like that at the same time. And it's very easy to treat at the same time. So it essentially halves your treatment time, because so many people don't want that long treatment.
Okay, we've got another one. Will wants to know how long the results last. We get this question a lot.
Well, you know, the results will last for quite some time. But here's the deal. If you ever have another need for treatment in another area, we have 8 areas that we can treat with this. So it's kind of one of those things where people see the results and then they often come back and get other areas treated because they have such a great experience.
Amazing. 8 areas for treatment. For all of you who are joining us live, go ahead and put in the comments below what area you would like to have treated with CoolSculpting.
And there's a prize for somebody who knows all 8 areas.
Is there? Okay. Maria, here we go. Maria, where can I get CoolSculpting? She wants to know what location she can get it at.
Well, you can go to CoolSculpting.com.
Perfect. So if you'd like to have CoolSculpting performed, please go to CoolSculpting.com. We have a physician locator where you can put in your zip code and find a physician near you. Helen wants to know, is it safe?
We have a great treatment with CoolSculpting. People do great and they have such a wonderful experience. Safety is something that has been clinically proven. It's something that is really unique to this product. Incredible. We've had over 6 million treatments with CoolSculpting. 6 million treatments. So that's a lot of treatments. Safe, clinically proven, effective.
Yes, so CoolSculpting is safe, well tolerated, and efficacious. We've had 6 million treatments completed worldwide in over 80 countries, making us the most proven technology in the non-invasive fat reduction space. Oh, we've got another one. What happens to the fat after treatment?
Well, that fat goes away when it's frozen. So it's frozen, the cells die, and then the body eliminates that fat. It's all done just seamlessly. You don't even know it's happening, but it's gone away.
Perfect. So after you have the treatment, you can just go about your life the same way that you did before.
Definitely.
Perfect. I think we've got a couple more. Mike wants to know, how does CoolSculpting work? What exactly is the technology?
So, you know, that's a great question. So for those of you in the audience who are wondering what exactly is happening here, it is really pretty simple, but it's actually kind of complex. So here we are, we have a treatment. This is that applicator. The fat goes into it, it's sucked into it, it freezes it. It's frozen fat, but it's not frozen skin. So in other words, the fat freezes at a slightly higher temperature than the rest of the body does, than water does. So just like when you put a stick of butter into the refrigerator, it's essentially frozen, whereas the fat is frozen at a little bit higher temperature. Nothing else is harmed. The fat is frozen, the cells die, they're eliminated, and there you go, and you have elimination of the fat.
I love that. You said it so amazingly for all of the people who are watching at home. CoolSculpting is a Harvard-based technology, and just like Dr. Schlessinger was saying, it's based off of cryolipolysis. It's easy, it's well tolerated. Oh my gosh, we've got another question. Too many. Katrina wants to know, do you need multiple treatments to see best results?
I think in certain areas, yes. Yes, Katrina. So I think that certain areas do well with it. So an abdomen, for example, you might have a treatment here, a treatment there. You know, so for example, on flip, you might have a treatment here, here, maybe one up here, one up here. That's going to be something that you and your physician will figure out, and that's something that is best done based on your goals. So if you just have a little area, maybe you do 1 or 2 treatments. If you have a larger area, maybe you do more. But here's the other thing. We usually do 2 treatments separated by about a month. So that's what really seals the deal there.
Awesome. So I'm glad that you're letting us into the secrets of your practice, but I want to just tap into something. It sounds like the assessment's really important, that we need to set goals up front because that dictates a treatment plan.
Absolutely. So here's the deal. With goals, I think that you want to make sure that your goals are reasonable. And really, we are not doing this as a treatment for weight loss. This is not going to lose you any weight. It's going to lose you size. It's going to improve your physique. It's going to take care of bulges that you don't want to see, but it is not a weight loss treatment. So a lot of people mistake that and they come in, but that's where we talk about goals. We talk about what the people are looking for and really get an idea so that they're happy, we're happy, and that the treatment is a success.
Wow, sounds too good to be true. Can you believe it? We have another question. Vanessa wants to know, does it hurt? I
Well-
think we should.
I think that you probably better guess of that. What do you think?
I would say that it doesn't hurt at all. Really.
Great.
I mean, there's. I think discomfort would even almost be a strong word. It's not bad at all.
Oh, that's amazing. So is it just a new sensation? So it doesn't hurt. You said discomfort's too strong of a word. It's just different?
Just different. I would say is a good word.
Yeah. Do we have any other questions? We do. We have another question from Christine, and she wants to know what areas she can have treated and if you can do multiple treatments at once.
Absolutely. So can you do multiple treatments at once? It's really very simple to do multiple treatments at once if you have 2 units. So it's something where, for example, I can put a CoolSculpting unit on the chin and do the abdomen at the same time, and it halves the time that we're here to do the procedure. So absolutely, that's a great idea. Good job, Christine, on asking that question. Now, what areas can be treated? We have the thighs, the abdomen, the flanks, we have the bra area and the lower back area, and then we also have the area on the upper arms. So it's
arms.
cool. We have so many different areas to treat.
You have so many places you can treat. It's so fascinating. For those of you at home that are interested in CoolSculpting, you just heard Dr. Schlessinger say that you have 8 areas of treatment. Oh, Sandra wants to know if she's going to have one of these 8 areas treated, how much does it cost?
Well, I think that that's something that varies from area to area. I think that the average nationally is somewhere around $2,000 to $4,000. For us, it's a little bit less in some areas, a little bit more in some areas, but it's basically something that you can get in a very reasonable amount of money, and you can get something that takes care of your fat very simply, effectively, and with very little cost. And also, we have financing for patients, so either care credit or Alpheon credit or things that we offer. And so it's something that people can afford.
So your patients have options when they come into your practice.
Absolutely.
Yeah, and it sounds like every single treatment plan that you perform for a patient is going to be different because every single one is customized for each patient. So they should be coming in to have a consultation to find out exactly how much their treatment is going to cost. Jordan's giving you a tough one, Dr. Schlessinger. He wants to know, are you going to lose weight if you have CoolSculpting performed?
No, I don't think you're going to lose weight. Now, I have seen a lot of people that use this as a way to get a jump start and then they go on to diet and exercise, but honestly, you're going to look so much better that maybe you'll end up going on diet and exercise and doing even better than you've done before.
That's amazing. So they see a transformation in their body, and that's encouraging enough for them to start a different type of lifestyle.
I've seen that quite a bit.
Amazing. Here we go. This is our final question from Paige. Does CoolSculpting leave any marks on the body?
Well, no, I've never seen any marks with it. That's the cool thing about it, is that it goes away. You could go to dinner tonight, Flip, and nobody will notice that you've had this done. Very nice.
Awesome. Well, we want to thank everyone for joining us live. Dr. Schlessinger, thank you so much.
Thanks for coming
having us
out.
in your practice. I really appreciate it.
It was a pleasure.
I have to ask you one favor.
Sure.
Leave us with something. If we leave here today, what's the one thing that you want us to remember about CoolSculpting and the treatment?
Well, it's Father's Day. If you're thinking about something for your father, dear old dad, you may want to consider CoolSculpting, or you may want to even consider CoolSculpting as a gift for yourself as a father, as a dad. So, I think that there's so much to be thankful for on Father's Day. We'd love to do this for anybody who is interested in this type of procedure, and we feel that there's so much opportunity for men who are desiring of treating their unwanted fat areas, and CoolSculpting is something that's easy, simple, affordable, and it's really something that should be accessed for more guys than you could imagine.
Perfect. We're excited for everyone to come into an office, have a consultation performed, a treatment plan that's customized to whatever area you would like to have treated. We're going to sign off and say Happy Father's Day to everybody that joined us. Happy freezing. Thank you so much.